All right, thanks so much. I don't know about you, but if you get on the scale on Monday morning like I did and you were kind of horrified, what happened here? Well, you know, we've had Thanksgiving and Christmas, and yesterday was the Super Bowl, and all of that is not good for our hearts. So maybe it's time to get back on track. Well, Go Red for Women is this month, and it has saved countless lives. In fact, 2,200 people will die today alone of either heart disease or a stroke. And this morning we are joined by some people who can really give us a leg up on this. Dr. Lance Lamott with cardiologist, Baton Rouge General, along with Christy Genzer. Good to have both of you with us this morning. Thanks so much. 10 years this has been going on, and how many lives have been saved, Christy, through this?
You know, by all estimates, 650,000 lives have been saved. But, you know, there again, we have 400 plus women die every year. So the fight is still on.
Yeah. What do you see so much as a cardiologist? A lot of times we think of men as having heart attacks and not women, but the opposite is true, right? Women have more heart attacks and strokes than men.
Exactly. Actually, women often fear breast cancer as their greatest threat to their health, but heart attacks, cardiovascular disease in general, is their greatest threat in terms of risk for heart attack, stroke, and other vascular events.
Yeah, why is that?
It's oftentimes it's just that symptoms are missed and not appreciated, and that's both on the provider, from the provider standpoint, and from the woman's standpoint, who may not recognize that risk. And so it's important to understand that.
I guess a lot of us think that men are under more stress than women, and
Exactly.
their hearts, you know, do that, but not at all. What do you advise your patients?
First of all, to know that, recognize the risk, particularly if there's a family history or if the symptoms are present, and women often don't know symptoms, and their symptoms can very classically be a little different than men.
And why is that? Why do women have different symptoms than men?
Well, it's not really understood, but
Okay.
you know, instead of those symptoms of crushing chest pain, it could be like breathlessness, profuse sweating. The pain can be in unusual locations, like in the jaw or the back. Had a couple of ladies with it in the shoulder blades. It's just really the presentation can be very different.
Interesting. Now, is that more for a heart attack or stroke, or it could be either?
Heart attack, mostly.
For a heart attack.
Yes.
And tell me this, and then sometimes people talk about a mild heart attack. Can that go away and someone's had a heart attack and they don't even know it?
Silent heart attacks, as we call them now. We often use that term, mild heart attack, but every heart attack is important. But even the mild ones can be very important, and certainly they can be silent. That's more common in diabetic women.
Interesting. Well, what happens if no one's treated for that?
Well, the heart can weaken over time, and there's a risk for cardiac arrhythmias, which can lead to fainting or cardiac death, sudden cardiac death.
So what's your best advice? Top 3 tips for women out there today listening.
Know the symptoms, be evaluated, and take it seriously.
When do you need to be evaluated? When's the age?
There's no hard-cut age, but it's really more if you have risk, if it's in your family. And I'd say probably make sure in your 20s that you don't have the risk factors developing, but certainly sometime in your 30s, early 30s.
All right. Well, we're all getting together, Christy, for Go Red for Women. Tell us about this year's event.
Yes, so this Friday, February 7th, we will be at the River Center for our 10th annual Go Red for Women Luncheon. It'll start at 9:30 with a silent auction, health screenings, a great deal of education, because again, like Dr. Lamont said, it is about prevention and education. And so that's what our movement's about. We will start with a fashion show, and at 11:30, and wonderful lunch. So please come join us. If you are not able to, know that Friday is also National Go Red for Women Day, and wear red and light up the capital city.
That's great. And for ticket information, tickets are still available. You can get a whole table or individual tickets, right, Chrissy?
That's correct. So you can actually go online at BatonRougeGoRed.heart.org and come join us. We'd love to see you.
And if no one has, Dr. Lamont, if no one has been to a cardiologist or even a doctor in a while, is it a good idea to go that morning and go ahead and get checked out? Will they have the skilled people to do that?
Yes, there will be screenings, and I think that's a great venue to get started.
Yeah, and you'll be in great company too, right?
Yes.
A lot of other people having the same questions.
Exactly.
Thanks so much. Well, great to see
Thank
you
you
both.
Thank you for
Happy
having
Valentine's
us.
Day.
Thank you.
Heart health right ahead.